sort of welcome Chief Connor. And typically, you probably don't know this, Chief, but typically before the Monday council meeting, the three of us generally touch base, and we call it our caucus meeting. And so generally that's the time when we do this, just to get prepared for the Monday night council meeting. And
Okay.
considering everything that's going on, wanted to. I know the three of us are interested in wanting to know about what's happening with the Division of Fire, and how it's
Mhm.
affecting your team and everyone within the department, and then most importantly how the services have changed in working with the community and working with the patients that you guys come into contact with, the
Mhm.
experiences that you're having. And I know we're most definitely interested in wanting to hear about what things have happened over the last month since all this has been going on. And so I guess really we just want to pass it to you to give some updates to us, and vice versa the community, because we will post this onto Facebook and let the community know as well as to what challenges and opportunities you've seen in the Division of Fire. And I guess I'll just let you talk for a few moments, and then we'll have some Q&A with council members Fennell and Hall, and we'll just go from there if that sounds good to everybody. So,
That sounds great. First off, thank you for inviting me today. I know that it's been kind of crazy lately around the world, but locally, it's been a challenge. Just dealing with not only the flood and the situation we had in South Newark, and now dealing with a 100-year pandemic. Um, Never did I ever think that I would be a fire chief of an organization, a very busy organization, during something that's this serious. And no level of education can really put you in the right spot in order to make good decisions based on little information. So that's what we've been doing right now. A lot of changes have taken place. It's really important to note that very involved in what Governor DeWine's been saying, and Amy Acton. Been listening to the news as much as I can, communicating with other fire service leaders. I'm very active in Ohio Fire Chiefs, the International Fire Chiefs Association. We get daily emails from them on what other organizations are doing as well. So the sharing of information has been paramount right now in making sure we're doing the best things we can for our staff and for our community. So there were a few obstacles really there at the beginning when we were not able to share information with certain people that may or may not have been diagnosed with COVID-19 and were transported by our EMS units. That has since been fixed and repaired with those organizations from direction from the government, that in the times of a pandemic and the national emergency, worldwide emergency right now, we are able to share information in order to protect our first responders and other people in the community. So that was a huge step for us. And that was probably at least a week and a half of emails and phone calls with Licking Memorial Hospital, Chad Brown at the health department, who we talk daily, text daily with information. He's been absolutely wonderful to work with. He is truly passionate about what he's doing at the health department and very engaged. So we're communicating at 10:30 at night in some cases, and 6 o'clock in the morning in others. So he's right on top of it, and can't thank him enough for everything he's doing for Newark Fire Department and Licking County as a whole. But getting down to what exactly is happening in Newark, to put it into perspective, we have spent about $10,000, probably a little over $10,000 now on COVID response. So that means PPE. We obviously did not stockpile N95 masks, Tyvek suits, because those are things that you just don't use. The expectation of a pandemic, once we did need the protective equipment, everybody needed it at the same time. So we had at 1.5 weeks of personal protective equipment on site. We have since, we're doing much, much better. As far as 5 weeks of usage, we never got close to where we were going to run out or anything like that. We were fairly prepared, but we did have 2 members of our fire department in Newark who were quarantined due to a potential exposure early on. And we have basically changed. They're back to work. Everything's fine now, but this was back when we weren't sharing information with the hospital, but now we are. So few things that we've done. We've taken one of our reserve paramedic units and made it a COVID transport unit only. So we've kind of stripped it down. We put Viz Queen between the front driver's compartment and the back passenger patient compartment. We have purchased 4 ozone machines that are disinfecting machines that we're using in our workspaces. We're using them in the apparatus and the back of the medic units. Those are just an added tool to wiping things down with Lysol and all of that. So cleaning has been just phenomenal right now. Doorknobs, everything in the fire stations, separating the members that are on duty from anyone from the public. So what we don't like to do is shut our doors to the public. They're always welcome in the fire stations. We always shake hands and welcome groups of children in for tours and things. We're not doing any of that right now. Just to be able to protect our workforce and, of course, the public, because we are high risk as well. So our call volume is usually about 35 calls a day in Newark. We're down to about 20 right now. I see that many people don't want to go to the hospital. They're calling EMS to be evaluated and then will not go to the hospital. So our transports are down about 20% last I checked.
Oh.
So the last time we checked, we're down. So transports... we're trying to keep those people out of the hospital if they don't need to be. So only high-risk people with the pre-existing conditions like diabetes, hypertension, any type of immunocompromised situation, cancer, MS, those types of things, they're high risk and we would transport them. But if you just have flu-like symptoms and your vital signs are within normal limits, we've been advised to just shelter them in place and have them watch to see how they're doing daily with their temperatures. Mm-hmm. I'm requiring all the firefighters right now to take their temperature twice a day when they get to work, and then halfway through the shift, they have to record that to make sure their temperatures aren't over 100.4. If they are, we would send them home. So we right now have 9 confirmed COVID patients living in Newark through the health department. That information is changing daily as far as the hospital communicating with the health department and the fire department. So we are adding that information, that patient's address, to the Licking County CAD system. So if and when we were dispatched to that address again, the information on the notes on our computers in the trucks would be that this is a confirmed COVID-19 patient living there, so we can better protect ourselves or make sure we limit our exposure to that person. We might limit how many people go into the house. We might limit, put an extra layer of protection on, those types of things. So the fire stations have been locked down right now, no family. Only essential mission critical vendors are allowed in the building. And that means our heart monitors needed their maintenance. We let that heart monitor maintenance man come in and be in his own area, in the apparatus area, and update our monitors and make sure they're working. Anything that has to do with essential type of things to keep our mission moving forward, we have been carefully letting those vendors in. But our mat service, coming in and changing the floor mats and those types of things are not going on at all at the moment. It's interesting to note, and I think that many of you, you're not hearing some of this in the media, but it is not just your standard flu-like symptoms now that is potentially having a COVID-19 patient that's testing positive. So we're seeing stomach issues right now. Nausea and diarrhea is one of the things. We've had one patient who just had nausea and diarrhea, had no fever, had no other known symptoms, but once upon arrival at Licking Memorial did test positive for COVID-19. So that's why the fire department's protecting themselves more than the average fire department may be doing to eliminate the chance of an exposure. We're hearing people losing their taste and smell. They're really not symptomatic after that, but if all of a sudden you can't taste your food or smell, that's an indication of what the coronavirus is doing to people. I think everyone's a little bit different. So
wow.
we're just taking it very, very slow here. We're making sure that I have changed our response to make sure that we're not sending only one person may meet a patient at the door. So hypothetically, you call 911 and you're having chest pains. You'll see two paramedics. One will stay back, probably on the front porch. The other may be talking to you from the front door with a mask, eye protection, and gloves. And they'll start questioning you just to make sure that we're making sure that you don't have these symptoms that we may want to back out and completely gown up or change our response in some way. It seems very insensitive for some people, but it's just in order to protect ourselves from getting exposed. It doesn't mean we will not treat anybody. We will treat everyone the best way we can per our medical protocol, but it is important to note that it's a whole different way that we're approaching EMS at the moment. And I don't want people to go ahead.
I was going to say most people, including myself, would not even think to go to the hospital if you have diarrhea or stomach cramps. I mean, that's kind of like flu, you know.
Sure.
So that, you know, I wonder if people are just not going because they think it's the flu, but
Right.
they really are exposed.
Yeah, and I think there are many people who do not want to go, and our medical direction is with Ohio State University. Dr. Ashley Larimore is our medical director. She writes our protocol and allows us to operate on the streets of Newark every day, and updating them and keeping the training for the paramedics. We communicated every single day through text message, emails, and phone conversations to find out exactly what we're doing. Ohio State obviously is. She brings all of those resources from Ohio State to Newark. We're very fortunate about that. She's also very involved with the medical direction at Columbus Fire Department, MedFlight, and Whitehall Fire. So we have a whole bunch of information that's coming in. I feel very comfortable with what her direction was, and it still continues to be. But we talked about a no transport protocol, which we didn't implement, but we did. As far as if somebody does not have diabetes, hypertension, any type of pre-existings that would cause them to have be high risk, we would not really want to transport them to the hospital. As the curve flattens right now, I see maybe a few more runs per day coming in. I think people are starting to feel like it's more comfortable. I do see that Newark will get back to being that busy EMS division that we are. Eventually, but right now there are still some people that don't want to call 911. As far as our response is concerned, it's been I don't even know how to explain it besides it's been very awkward for everybody. It is our run volume is down probably 15 calls a day, but the runs that the paramedics and firefighters are going on right now are twice as stressful on them. Just thinking that you may have an exposure or your equipment fails. They also have family members at home that they're going to the next day, and some of them have their own medical problems as well. I mean, there's 80 people. So you can think of there's a plethora of different things and families out there that they worry about going home to. So our cleanliness, changing our uniforms, washing them, keeping your hands washed, wiping everything down is very, very important for us right now.
I just wanted to, so the actual runs are down, but the transports that you're taking to the hospital are down. So
Correct.
Are the people that are calling, they're just wanting to get some type of sort of first aid check or some type of just to see what the seriousness is of they're using as a sort of this first instead of going to urgent care or some other place, they're calling the department to just get that first check. Is that what you're experiencing? Or
that is exactly what's happening. I just talked to one of our paramedics on the phone last night in regards to a patient they had transported that did test positive for COVID-19. Just checking on them, making sure that everything they were doing fine and that they had their PPE on, and determining whether they needed or not to be quarantined, which they're following my directive and wearing all their personal protective equipment. But they said to me that, yes, they're going into homes, they're checking people, and they're literally saying, okay, I think I'm okay. I'm not going to the hospital. So I think they're calling 911 without any intent of really being transported unless we found something that was really significant enough for them to go. But flu-like symptoms right now are not enough unless you have a pre-existing condition that would require some additional testing.
Mm-hmm.
Do you think possibly that the public thinks that if they walked in maybe to the lobby there, they could be tested? You're not testing.
No, we're not. We are not testing. I know
Right.
that
Okay.
the Borough has a drive-up test, which they are evaluating each person that drives up to see whether they think they fit the criteria to be tested. And I don't know that everyone's being tested that drives up, but if you have signs and symptoms, that they're making that determination right there on site, they will test you. The issue we had early on in this was the test results were taking 10 to 15 days to get those results. So if we had a potential exposure at the fire department, for instance, you got to wait 10 to 15 days to get those results. LabCorp was a problem. They were sending a lot of their testing to LabCorp, a private lab, and that we had no jurisdiction there. The health department has no jurisdiction there to try to expedite first responder testing because we want to make sure our workforce is safe. If you can put it into perspective, if one of my firefighters has a significant exposure to a COVID-19 person and then works for those 4 or 5 days before the test results came back,
right,
he exposed an entire shift of people.
Yep.
And that would be detrimental. That's my biggest fear right now, is that we will have 10 or 15 people quarantined, and then we won't be able to staff potentially. The national emergency does allow that the fire chiefs and city leaders make changes on schedule. And we did talk with the union regarding that. If it came down to a third of our workforce is unable to come to work, then we would have to probably change the schedule. We are not there, and I don't anticipate going there as long as we continue to protect ourselves and keep our social distancing, not allow the people in the fire stations. It's been working. So that was a big fear of mine early on, and everyone else as far as that's concerned. I have to provide service to the community, even throughout all of this, and I want my workforce to be healthy. So it's been difficult, but I feel like it's getting better. It's the new norm is not quite there yet, but I can feel that it's becoming the new norm. And it's been difficult.
Now, right now, we had some potential situations where we had prospectively thought that some members of the team were infected, but they ended up not being infected, correct?
Yes, and I did err on the side of safety at that time. I didn't have all of the information rolling in at the time. I could have gone either way with it, as far as you will return to work and wear a mask, or you will be quarantined. The issue was that the tests weren't coming back. We didn't know the test would be back for a week, and that would be 2 shifts, 2 24-hour shifts. They would potentially infect everyone else. So I erred on the side of safety and put them on quarantine. When the results came back negative for that patient is when I put them back to work. But that was early on when this was all brand new to everybody. Everybody's kind of just scratching their heads on what exactly to do. Not just myself as a fire chief in Newark, but all of my fire chief comrades that we talk daily. They're scratching their head as well. Medical direction, Board of Health, Chad Brown at the health department. I've talked to Olivia Biggs a few times. They've all been very, very, very helpful as far as helping me make decisions that in the best interest. Some of the decisions that have been made as far as public safety workers are concerned, what to do if you are potentially exposed, aren't real popular, because they're telling, unless you're symptomatic, you return to work as a public safety worker. And that's just very dangerous for an organization our size. And we're a medium-sized fire department. There are many other departments throughout the state that are much, much smaller than Newark and wouldn't be able to have a response if they had any type of exposure.
Now, I'm curious, Chief, has there been any discussion amongst all the leaders of the public safety different agencies? I work at Denison, and I believe that Denison has started working with Lick Memorial Hospital as being a quarantine site if any of the nurses or other health professionals do become infected. They're using some of the empty, we have a lot of empty dorms right now. And so I think they're using some of those dormitories as places where people could go if they do need to quarantine themselves. has any such agreement worked out that you're aware of with other, either police or fire or anything of that nature?
Well, we worked with Local 109. I know that I was on the phone with Neil Murphy, Lieutenant Murphy, who's on the executive board for the union. We had discussed a few things several weeks ago about the Girl Scout camp here in Licking County or some other issues. The information that I'm receiving as far as management information throughout the state is you need to let your employees know to have a plan B on their own. And I did send that email to our membership. Local 109 was working in the background and did contact Doubletree in Newark. And Doubletree has offered to work with us if that happens, where we do have somebody, hypothetically, their wife may be immunocompromised and they can't go home to them.
Right.
That we can somewhere to send them. That'll be something we haven't had to do yet, but something that we'll have to work through if that does happen, in order to. But most of us do have Plan Bs. I mean, as far as with our families are concerned, so it would be probably a small percentage of people that we'd have to really work with to get them somewhere to go.
Well, if you were needing that type of contact, I'm happy to get you into contact with the people at Denison, because like I said, there's a bunch of empty space now at the school that they're making available to the hospital. So I don't know why they wouldn't do the same for. At least I could get you that information so that conversation can happen. So
I would love that.
Okay.
Absolutely. Always looking for plans, so I appreciate that.
Okay.
Good. Anybody else have any questions so far, what I said?
Not necessarily.
I wanted to thank you for having this chat with us, because it's so informative that I think most people wouldn't even think of the things that you've had to go through here in the past few weeks. So it's appreciated, and I hope everyone is safe.
I do too, and that's my biggest concern. The heavy lifting right now is the paramedics and firefighters and police officers on the street right now that are functioning every day, most of your shift in the unknown. And usually we have somewhat of control of what we do when we respond on emergencies. The big unknown of the coronavirus is scary for everybody. We run into burning buildings and do a lot of things that are dangerous, but we train and we're controlled. That's a controlled environment in our eyes, where this is completely out of our control, but we still have to respond. So my heart goes out to the men and women of the police and fire departments that are actually out there with their hands on people every day. I'm trying to send daily emails to them to let them know I care about them, that I'm thinking about them, and I'm working hard to make sure that we are doing everything we can to make sure that they're safe. That's really, really important to me. And it's been a great relationship. Local 109 and our administration here, with myself, Deputy Chief Metzger, Captain Lynn, our EMS coordinator, we have communicated with them on supplies, all kinds of different things. We're communicating with them, and it does, as a team of people together, better decisions are made, and I think it's been working really, really well. Our relationship has been, actually has grown throughout this pandemic, that we can work together and figure out answers that are difficult.
That's good to hear. I'm curious about your, you mentioned earlier that you spent $10,000 for equipment.
Yes.
When you say equipment, is that like you mentioned like having to order the ozone machine, cleaning machines for each station,
Yes.
N95 masks, and what was it? You said suits. Some type of suits, was it?
They're a Tyvek suit,
Okay.
so it's like what a painter would wear. Those white suits that have
Okay.
put on them. They're kind of plastic, very disposable, but we have learned that we can wash them, and we are reusing them. We can use them in our extractors, but that's just extra gloves that we wear. Hand sanitizers around the stations. You never have enough hand sanitizers. Clorox wipes so we can wipe down doorknobs. I mean, as the list goes on, the spreadsheet right now is, you go through the spreadsheet and you see how much we actually have and need to be clean. We don't want to transfer any type of illness to anybody that works there. So it adds up very, very quickly. The N90, we just received an N95, 500 count of N95 masks this past week. So we should be in good shape with that. But we also bought N100 masks, which are, you might see, they look kind of more of a rubber on the front, cartridges on the side,
Mm-hmm.
respirator. So all the paramedics and one person on the back of the fire engines do have an N100 mask with their own cartridges that they can take off and reuse their next shift day. So everybody has their own cartridges. We have ordered 30 more N100 masks and hoping that everyone can get their own. They're a little bit higher quality than the N95 mask that you see that we're using. So we're that's something we can keep forever. Well, not forever, but we can reuse and save money instead of buying those N95 masks.
Are they wearing them on every run now? Is that the case of when they're using those?
It is, and that was a directive from me about 10 days ago after we did have that potential exposure on a run that we did not know this patient might have had it. So I made a call to go ahead and say my expectation is everyone is geared up, PPE'd up while you're going up to a residence. We did train our members to say one of you walks up on the porch and engages the patient from at least 6 feet away, gathers more information, and try to keep us from exposing both of our individuals on the paramedic unit that day. One would potentially be exposed, worst case scenario. So we obviously that's not the case when we have a cardiac arrest patient or a patient that's got severe respiratory difficulty. We have to be all hands on and taking care of them, and we will. But we're making sure we're taking a few extra seconds to get all of our personal protective equipment on before we engage that patient within 6 feet.
Okay. Now, do you see you're needing to transfer some dollars or making a request to council to get some more dollars in order to? I mean, we're only in April. And so
right.
I know you're spending a lot of your funds. So
Jeremy, that's a great question. We are keeping track of every dollar spent for our COVID-19 response. And that is also for any time we've had somebody that was potentially held over for decon after shift. So there could be a small amount of personnel dollars associated with that, but mainly they're going to be PPE and supplies. Any dollars we've spent, we're keeping track of that. So if the city can recover those costs from the government in the future, we will be prepared to submit that spreadsheet and all of the associated documentation right away to the mayor and his staff, and all the councils will know. We very early on, we got organized we knew that this is where this was going to go. As far as budget is concerned, we are going to need, we're doing fine on our budget at the moment. We have some expenditures that, will I come back? I guess your question is, will I come back and ask for more money? I always don't want to do that. We're going to try to do our best not to.
Well, this is an emergency situation, so.
It is an emergency situation. We are taking money out of our EMS line item budget that our EMS captain uses to buy EMS supplies. So right now we're measuring that. This week we have a meeting to get together and comb through all of our line items to make sure that we're doing okay and give the safety director an update on where we are with our budget. So I'm very conscious of that. I'm always in the budget looking to see where we are spending money and making sure that we're going to make it through the year. We've been very, very, very conscious and with our budget since at least the 5.5 years I've been chief. That's one of the things we talk about every day. And I'll do everything to try to make it through the year without having to ask for additional money. There is a high probability I will be back asking for money, but not at the moment.
Well, it's perfectly justified, though. I mean,
Sure.
I can't imagine not.
Sean, did you want to speak earlier? You sort of wanted to. Did you want to jump in?
Yeah, I was just wondering. I mean, I think it may have answered it a little bit, but I guess what I'm wondering is what can we do, on city council to be able to help and support all of the efforts that you and your team, are going through right now?
Yeah, that's a good question. The answer I have for you is I don't know. Right now we're doing it. I'm just being honest with you. Right now we are doing everything we can. That's why you have a fire chief. I work very hard to make sure that you just are informed, and you are somebody that can give me the things that I need, in an emergency situation. We are doing fine with supplies at the moment. So until I run out of money or supplies or need any type of government assistance on top of what's been provided already, the only thing I would ask for is prayers for our staff, for the entire staff, the police department, to our safety, because it is still a very dangerous dangerous environment out there. Communications is very important. So always feel free to reach out to me anytime you have a question, and I'd be more than happy to take the time to speak with you and fill you in on what's going on. So,
Chief, you had to. We had some new hires within the department here recently. How's the adjustment in getting the new hires into this environment in addition to the pandemic?
the new hires have been great. We are. I love to have new people in the fire station. I have met with them last week, each individually, to let them know that this is an awkward time for the fire department as a whole, not just Newark, everywhere. And I did want them to think this was the footprint of what Newark Fire Department looks like, and just hang in there, because it is very awkward for everyone right now when you're passing somebody in the hallway and maintaining 6 feet, and there's no shaking of hands, and those types of things. It can seem like a very insensitive environment to work in. And that's not what we're all about. We're a family at Newark Fire, and I hope that they can hang in there long enough to see what we are all about. And they're all very bright, very excited to be part of our organization, and I think that they're going to be just wonderful. We do have, I think, 4 more positions right now to fill, but no one is doing any testing right now. So we can't get our CVSAs and the psych tests and the pension physicals done right now. So as soon as the restrictions from the governor are lifted and things open back up, we'll be able to start interviewing and hiring and filling the spots that we have open right now.
Great. I know that just communication and transparency is very important to me. It always has been, and so I appreciate you willing to do this type of call to talk with us, to have those conversations. Council members D or Fennell, did either you have any more comments or questions for the chief? And
not at this time. I know that I can always pick up the phone and call if something arises, but I wanted to thank Chief Connor and Jeremy. I wanted Chief Connor to know that at council tomorrow, during miscellaneous comments, you're going to let the council know that we've had this conversation, and see, if possibly we could invite Pat to the next meeting. If I would think that other council members would be interested as well. So maybe, if you bring that up, Jeremy, tomorrow, maybe that'll get the ball rolling a little bit,
Yeah, I guess I view it as, we are the representatives of our constituents and the residents of Newark, and any public presentations to us is to inform the public in general.
Right.
And so,
Right.
so I think it's important, and I know I have been in communication with the chair of the safety committee and with the president of council, but almost definitely tomorrow night extend that invitation again, so that both, not only the fire chief, but I also would like to hear from the police chief as to what's going on with our officers. So, but yeah,
Yep.
I'll be happy to make that comment tomorrow night during the meeting. So,
Great.
Sean, did you have any last comments you wanted to say?
Yes, I just wanted to say that, hearing everything that you're doing makes me feel a lot more secure. And I'm just really grateful that, you and your teams are out there working hard to protect this community. So thank you so much for everything.
You're very welcome. You're very, very welcome. Thank you for the comments.
Well, thank you, Chief, and appreciate your time. And we all have a lot of mutual anxiety right now, but it's your calm demeanor just to give some reassurance. And so glad to hear everything is going as well as expected as can be right now.
You're very welcome. I'm here for you guys. Anytime you need something, just give me a call. I'm here for you, and I'll work hard for the city of Newark and to protect it every day. I think you know that. I love the city of Newark. It's been great to me, and I'll work every day very hard for you.
Great.
Oh, we know that.
Yes, we do. Appreciate you, Chief. All right. Well, everyone have a great Sunday afternoon, and we'll talk to you soon.
Well,
Take
you
care.
too.
All right. Thank you.
Bye.
Thank
Bye-bye.
you.